Hello, YouTube. Welcome to another edition of, yes, Johnny Bill's Pharmacist World. And today's episode is called Medicare Doesn't Care. What really bothers me is how our society treats old people. This is nothing new. It's been going on for many years. And it's not only sad, it's just plain wrong. So, here's Johnny's rantogram of the day. The political climate in our country today provides free health care for illegal immigrants and to a large portion of the population that are on welfare, but lets homeless veterans sleep in the streets and screws old people like it's nothing to them. I got two stories I want to share with you today. The first is about Jim and his wife. The second is about yours truly. And both stories illustrate that the word care in Medicare is an oxymoron. Um, Jim was one of our customers at Family Pharmacy, and he and his wife both took a lot of medicines because they both had pretty severe heart problems. Cardiovascular disease is the most common condition in our country and the number one cause of death, and it has been for a long time. Heart disease in the United States kills about 600,000 people a year, and that's one in every four deaths. And it's been the leading cause of death for both men and women for many years, so this is nothing that, Medicare didn't know about. Coronary artery disease, which is what both Jim and his wife had, is the most common type of heart disease, and it itself kills 370,000 people a year. And over 735,000 people, Americans, have heart attacks. And of these, 525,000 are a first heart attack, and 210,000 are people that have already had a heart attack. Both Jim and his wife suffered from the medical term atherosclerosis, which means hardening of the arteries, and that's what caused their heart attacks. They both had stents in their hearts. Jim, interestingly enough, was actually catheterized and brought back to life by a doctor who unblocked his heart with a catheter while rolling down the hallway at Roanoke Memorial Hospital because he coded and his heart stopped before he could get to the heart catheterization lab. It's an amazing story of how his life was saved, only to be let down by his country that he worked so hard for all of his life. Jim and his wife were victims of financial devastation and the loss of his retirement funds due to the donut hole. The donut hole, which is the coverage gap in Medicare Part D, was devised in 2006 when the prescription benefit was first brought into play, and it's a way to help pay for the program. In reality, it's just another dirty trick of the PBMs that has made them billions and billions of dollars in the last 13 years since its existence. So the coverage gap, or the donut hole, is a bad thing, and they still have it. It's been reduced some, but it's still a dirty trick. As you can see, there's a slide I'm going to put up here that once a person is brought into the donut hole, they enter the initial phase when they start out, and that's the regular phase. They have to meet a deductible, which is bad, and that's what costs them money. And then they get into this donut hole, then they have to pay more, and the insurance plan pays less. And it's a dirty trick where the insurance plan and the PBMs shift their financial responsibility from them to either the drug manufacturer or the government. So at the catastrophic phase at the end, they reap the benefits of a much lower financial burden going to the insurance plans and particularly the PBMs, which is uh, 80% going to the government in the catastrophic phase, the last phase after they get through the donut hole. The donut hole is essentially a way of saying, pay me $3,000 out of your pocket to elderly people. And every year it just eats up their copays plus their deductible plus the donut hole. And for somebody that's got heart disease or diabetes like me, and heart disease goes with diabetes, people that are really sick that have very common chronic diseases end up paying three, four, five, $10,000 a year, and it starts eating them up. So Jim and his wife both were that was happening to them, and I was the patient just ends up having to bear higher costs year after year, and due to the drug costs, they're always increasing. It continually adds to this until their out-of-pocket costs eat them up, and these are elderly people who are surviving on Social Security alone in most cases. Sometimes they have a little retirement fund, and they pay more and more out of these costs, and they have no way to replace that money. It just eats them up. And it's no secret that they all know it, and nobody else in our country seems to care about it. The elderly people know about this, and they keep talking about it, they keep complaining about it, and nobody hears their voice except pharmacists like me. And it's made me very, very sad. Um, One day I was doing a comprehensive medication review for Jim, and he's a guy I've known for years. And I was sitting there across the table talking to him the way I'm talking to you right now. And asked Jim about one of his heart medicines. Are you still taking it, and how many times? And his eyes began to well up. And he said, John, he said, I'm a steel worker, and I retired years ago, and I helped build this country. He said, if you weren't good at what your job was as a steel worker, we didn't have any safety nets. He said, you would fall and die. And he said, I've built the bridges and the skyscrapers of our country. And when I retired, I had a pension and over $100,000 in the bank. And he almost started to cry, and he said, I'm getting ready to lose my house and my car. And man, I didn't know what to say. I wanted to help him. I couldn't help him. I didn't have enough money to help him. The system failed Jim, and it's failing a lot of people. It's always failing, and it's like we brag about how good we are in this country because we got Medicare, but Medicare really doesn't care. So, we need to improve this system. We need to lower the copays, lower the deductibles, and quit putting as much money in these fat cat pharmacy benefit managers' pockets and let these elderly people have more real golden years. Okay? So, um, I'm telling you this to help people like Jim. And he deserves it. He built this country. He built the skyscrapers you go up in. He built the bridges that you drive across. And Jim deserves this, man. It's only fair. It's only loving. It's only the way to be. And unfortunately, it's not the way our country sees things. So I'm going to talk a little bit about what's happening to me. I've been on disability for over 2 years, and they make you wait to qualify for Medicare if you're on disability. And so I've waited the proper time, and I qualified for Medicare in November. So what's going to happen is I'm going to switch over from a regular commercial Obamacare plan that I've had to pay for myself with the tax subsidy game, which was ruled by the Supreme Court as a tax. And so I've been getting a subsidy in playing the Obamacare shell game, which I've gotten along okay on. And because I've met my out of pocket maximum for 2 years in a row, my copays have been low on my drugs, but that's going to change. I'm on insulin, I'm on Victoza, I'm on so that when I hit the donut hole my first month, because I'm on 20 prescriptions and 3 of them are prescriptions that cost over $1,000 each. So I'm going to hit that magic $3,000 donut hole mark the first month and go into where I have to pay 25% for all of my prescriptions. 25% of a $900 box of Victoza is, do the math, 25% of 5 vials of Humalog insulin at $300 a vial. Do the math. 25% of 3 vials of Lantus insulin per month is going to cost me what is estimated on the plan finder at Medicare.gov at $25,000 a year for my drug costs. My disability check is $30,000 a year. Why I'm talking to you today, folks, is I got a question. Why in the hell does a government who I paid $500,000 in federal income taxes to in the last 20 years wants me to survive on $5,000 a year and then give the rest of all that money to the fat cat pharmacy benefit managers and insurance companies? Why are the PBMs and the insurance companies more important to the government than my life? Answer to that question is in the Bible, folks, and it's called the root of all evil, and that would be money. Okay, so what I want everyone out there to do is talk to your legislator, write a letter to the editor, get on Facebook, get on YouTube, scream loudly that we've had enough, that America has woken up and we see this evil and we're going to fight it with everything we got. And tell them that you heard it on, yes, Johnny Bill's Pharmacist World. Take care. God bless America. Amen.